finally, Tina Thomas, CEO of Edmonton Community Foundation. This is the 4th largest community foundation in Canada and the largest non-governmental funder in Edmonton. Tina's going to contribute her expertise for us today. So I would like to open to all panelists with kind of an easy question. Edmonton is known for its innovation capacity, as you've heard. How do you each feel that the city can harness its innovation power from the community, from post-secondary and social serving organizations to tackle some of these challenges? And I'll start with you, Francesco.
That was the easy question, hey? I think what I find, so I'm a physician. I've worked for 16 years at Radius Health. It used to be known as Boyle McCauley Health Centre. We have a mandate to care for Edmontonians who are homeless or precariously housed, have complex mental illness, substance use disorders, recidivism in the criminal justice system. And I think the innovation points we find are where people's experiences intersect with other sectors, so the cross-sectoral building. A great example, Pilar at the Edmonton Library, creating a space where the homeless can come, use a computer, they have social workers there, helps our clients, and we're able to connect and develop collaboration through that. So I think just the collaboration between agencies where it's often not seen or needed. I know for our clients, I can give you a very concrete example. A lot of our clients experience recidivism in the criminal justice system, and if you don't have a phone and you don't have an address and you don't have a day timer, it's hard to keep track of when you have appointments with your probation officer. And so sometimes when we have health appointments, if our clients consent to it, we can actually, as part of our health visit, get them on the phone with their probation officer, and that prevents them from breaching conditions, which will then land them back in an incarcerated state away from community resources that will help them. So a very simple example of how we can innovate to find ways forward.
Thank you so much. That's a good baton pass to Pilar, how you're already working together. But, Pilar, I've had the privilege to work with you as the library's innovator in residence. But I would say that I'm on the front end of hope. I meet a lot of startup entrepreneurs, but I also see a lot of community health challenges that your staff is facing right outside my office at EPL. Let's talk a bit about that.
Am I working? Oh, good. Thank you so much for the shout out to EPL. And I think we are one of the last, if not the last, public spaces that welcomes everybody from all walks of life with that spirit of unconditional positive regard, no matter what their background, in our communities across society. And I think that is really what drives our service vision. And it's also around being community-led. So working with community partners like Radius, like the Bissell Centre, like Alberta Health Services, to provide services that folks can improve their well-being and their health. I think we don't always think of the public library as a contributor to health. And we know that it's a connector. When we were doing the engagement for our Milner Library, there's a beautiful quote that somebody said, "The library is the opposite of loneliness." So you can go to the library and be alone, study alone. You're with others though, and that contributes to health. Reading is a component that contributes to good health. Early literacy is a factor in health. We have health resources. We have Innovator in Residence that helps folks with business, that is a contributor to health, to well-being. And I think we provide all kinds of supports to our staff in terms of mental health first aid, disarming folks, trauma-informed service that help them. Folks who work at the library, for the most part, really want to be there and want to provide services and recognize that includes both challenges and opportunities of being that public space.
I see Tina has a question, but I have a quick follow-up, which is, in your mind and with your understanding of the history of libraries and libraries in community, does this represent a change, or is this just what libraries have always done?
I think we've always done it. I think what we're seeing is a change in our society. So we're becoming the de facto triage center for things that probably aren't our mission or our mandate, because there's nowhere else to go. So we don't have the appropriate levels of care for folks. With the deinstitutionalization of mental health, I think that contributed to more folks on the street who just need somewhere to go. So I think that's a change. It's the societal impacts, the increase in folks who are houseless, mental health supports, and I think that's been exacerbated by the pandemic. I think we've always been about relationships, though, and connecting folks to learning, to information, to support, and space where they can just be.
Thank you for that. And Tina.
I'll just go back to what the question at the start that was answered by both, as far as how do all these groups work together. And what's interesting for me, because you both gave examples about I'm incarcerated, but I'm recently incarcerated, I don't have a phone. Or you're talking about literacy and health issues. And I think that's where all these types of organizations can be thinking, is the interconnection. So I think that's something we don't always think about. There's a fantastic community foundation in South Florida called Collaboratory that's looking to solve all the social issues in South Florida in a generation. And what they've been doing is mapping interconnections that you might not see. So for example, one of the top reasons women don't leave abusive situations is because of shelters for their animals. So are you seeing that there's a connection between animal shelters and domestic violence? Maybe not. Eric Ambitan from End Poverty Edmonton talked about the connection between high school graduation and having a caring adult in the school. So you're thinking about remedial tutorials and other programs to help people academically achieve, when actually having someone care about them might be the determinant of whether they graduate from high school. I mean, I think we understand, and there's lots of programs that talk about food and food security. I mean, insecurity is on the rise in Edmonton. Edmonton Public Library will be launching a report on food insecurity this fall, and it's on the rise. And so we understand that kids that are hungry that go to school are not going to pay attention, are going to misbehave. So again, I think it's sometimes thinking about what those interconnections are and the different organizations that can come to the table to address them.
And is part of your MO to kind of enforce strange bedfellows working together, or seed collaborations before you, let's say, invest in a program?
Yeah, so we are a funder, Edmonton Community Foundation. I don't think we're looking to enforce. I think our interest is the same as the interest of the organizations that are serving the public. These are huge issues, and we don't want to address them in piece parts. And I think that's what we've been doing a little bit. So I think the organizations are also interested in thinking that way. I think that's why Radius is here. That's why CMH is here. So I think that is the interest of all of us. It's just not always easy. And this is another piece. You get into your silo of your work and the problem that you're solving, that sometimes it is let's step up and look across to see what those interconnections could be.
Yeah, and I think if I can chime in there, I think it's the interconnection that you're talking about. I think that is the innovation and the opportunity. Often, as Reg said earlier, we often look at technology as one of the innovation components, but really it's the interconnectivity and the collaboration. You mentioned also that there's I'm a board chair with the Canadian Mental Health Association. We have an Edmonton regional group that does a lot of work within the community, but in some areas where programs are run, that maybe it may overlap in some ways with people at the library, with people at your center, and so on, and right across the community. But I think that interconnection is an opportunity for us from an innovation perspective, for sure.
And from your vantage in governance, what kind of changes are you seeing in terms of mental health awareness, mental health solutions, and the destigmatization of mental health, specifically post-pandemic?
That's a great question. I think from a governance point of view, I think that within CMHA itself and within one of the groups that's within our federation is the Center for Suicide Prevention, and working together. How do we work as well together so that we can deliver services, community mental health services, as best as possible to the community within Edmonton, within Red Deer, within Calgary, wherever, and also in coordination with other partners that are in the community. So I don't know if that really answers your question from a governance point of view, but I think that there's a lot of stakeholders at play. Like we're talking about these organizations as one example. You've got government, AHS are important components of that, the city of Edmonton as well, but also there's equal opportunity with corporate Edmonton, or the startup community and the interest in mental health, community mental health, and how that impacts the workforce, how that impacts the productivity of people, of all of us. So I think that's an important component as well.
Okay, thank you.
I have some thoughts about the governance, not necessarily related to mental health, though, and I do think we are excellent at collaborating. I think there's a lot of collaboration. I think where we could do better is that rigor around process. So we see things to completion, and sometimes asking the community who they think is in the best position to lead an initiative. We got a lot of work going on around downtown vibrancy. There's so many different organizations that are working on this. How do we come together, and there's a rigor around the process that we agree to, who's in the best position to lead and agree as a community. I think that will help leverage all of the best interests and efforts and passion about solving some of these big issues.
Can I add to
Please
that? Because I totally agree. Because you asked the question about whether we're enforcing this, and we're not. I don't think that's our role, but we're definitely involved in conversations with charitable sector organizations, nonprofit organizations, to say, how do you do this together, and how do you do this together where it's clear who's in the lead? And that's hard, because I think what ends up happening is good intentioned organizations start to scope creep. To think, I am a mental health organization, but I'm dealing with people and they're hungry, so now I'm going to deal with food security. And well, now they might need some workforce development, so I'm going to add job training in there as well, as opposed to thinking, that's not mine to lead. I can work with someone who can do that, and I'm okay to take second seat. So I think that's where, as Pilar said, where can people say, this is not mine to own, I'm going to participate, I'm going to provide input, I am going to work with, but I don't need to be the lead on this. I don't need to grow my world.
Yeah, that very much aligns with the approach we take at Edmonton Unlimited, where we have what we call pathfinding. So entrepreneurs would come to us, for example, and we wouldn't just suggest our programs as the only thing that can meet their needs. We would also send them to Business Link or the Makerspace at the library or what have you, but we very much see that navigation as key to, maybe lead from behind in that way. All right, Francesco, I will ask you, I'm very curious how you are measuring results and what kind of pressure you might be under to deliver to multiple funders certain data sets or evidence.
Yeah, and to build on some of the conversation that's already occurred when we talk about kind of sustainable approaches and understanding who leaders are, sometimes the changes that we see will take generations to make significant difference, especially with some of the health challenges that I'm facing. I recognize I come from a very kind of particular segment of society, right? I work almost exclusively with those who experience homelessness, and but I think, part of the challenge is how do we just to speak frankly, I think a lot of the resources we see come through political will, and that comes in 3-year cycles. And unless we are able to have funding, or unless we're able to have plans that last for more than 3 years or maybe 10 years, it's very hard to garner traction on any of these issues. And so I think that when we talk about measuring change, I will have funders come to us and they say, well, you're a health organization, so how many colonoscopies do your patients get done to prevent colorectal cancer? How many mammograms do you get done? And I think you're asking the wrong questions. I'm like, when you look at the prevalence of sexual abuse in clients who are homeless, or the clients we serve, it's somewhere in the 90% for women and about high 80s for men, compared to baseline population of about 1 in 6 for men and 25% for women. And I think I have had so many clients say, I'm not ever getting a colonoscopy, and it relates back to the developmental trauma. And so we try to find ways to measure what is progress, how are we making a difference. I had a client who literally was living in dumpsters for 2.5 years until he was hospitalized with pneumonia in both his lungs. And it created an opportunity for us to go there. I went with a social worker and we said, do you think it's a good time now to maybe consider getting housed? And that was a feat in and of itself. But he remained housed for the rest of his life. And I think, but no funder is going to ask you, how long did someone stay in an apartment for who was previously in a dumpster, right? And so or we get questions of, so did this person, do they have a job? Are they contributing to society in a meaningful way? And I think part of innovation is understanding measures of success in a different way. For people who have severe developmental trauma, who have developmental challenges because of FASD, things like that, we have to be able to adjust expectations so that it's not from the context of our own experiences, but success might be measured very differently. And so when you ask about how do we measure success, we actually do very well. I'm not trying to say as a health organization, when we get independent review from the Health Quality Council of Alberta, we do as well or better than other health centers in the area, and that's working with a very difficult population. But I think sometimes we're just asking the wrong questions, and we're looking at Band-Aid solutions instead of understanding root causes. When we look around here and we see all the encampments with hundreds of individuals experiencing homelessness, and the solution might seem, let's just get a hotel and put everyone in there, and that way they have a home. It's a Band-Aid solution. We have to look at the fact that when our organization has surveyed these individuals, the prevalence of developmental trauma measured by ACE scores, adverse childhood experience scores, is about 93% in the population compared to about 12% in the general population. And so how do we address that as a way to mitigate some of what we're seeing, which are just symptoms of much deeper causes? So, and that's hard to measure. It's very hard to measure how are we moving the needle on those root issues that are manifesting as what we consider social disorder.
You covered a lot with that example, and it was very moving. But it also made me think about the importance of co-creating these metrics with the populations that you serve, with your leadership, and then with your funder, so that it's not kind of coming down from on high, imposed on you with language that's not relatable to your core clientele.
Yeah, and it's interesting because right now the opioid crisis is a huge issue, and and I've been at the organization for 16 years, so I've kind of seen the evolution, and we sometimes get funders who come and say, well, how are people doing in terms of their recovery? Are they achieving sobriety? And I think that is one measure. You can take a urine drug test and you can look and see, is there fentanyl in there? Is there methamphetamine in there or not? But there are other parameters. For example, if I have a female client, to her it may be important that she hasn't had to prostitute herself 28 times that month in order to survive. And if there's still fentanyl in her urine, maybe that's not the biggest issue, right? Or if someone's had to, been able to, to take their HIV medication or actually show up for doctor's appointments, those are other markers of success that we often don't consider. Even their emotional well-being, if they're able to actually sit and talk to a psychologist and start to unpack some of the developmental trauma, that's a pretty profound change in their life. But there aren't metrics that really capture that in a meaningful way, and there certainly there isn't funding that necessarily correlates or that sort of metric doesn't leverage funding necessarily. It's a bit of a roundabout approach.
I mean, what I hear you saying is that when you look at something through an intersectional lens or a gender lens, the innovation can often come from that perspective. Thank you so much. Pilar,
Can I just add?
Oh, yes, please do.
I'll just add one to that, because I think we get focused on the acute because we see it in front of us. There's a homeless encampment, there's an opioid crisis. So all the money, the funding, the ideas go to the acute, but we don't solve it in the long term if we're not thinking about the root cause. And I don't know if we have agreement on what the root causes are. Like, I have some ideas on what I think root causes are, but do we even have a general idea of what those root causes are that we should be addressing? I think early learning is certainly one, trauma is certainly one. So I think there's, like, as a funder again, I think we want to see a mix of both, where we have to deal with the acute issues. We can't leave them, but we also have to accept that we have to be patient and have discipline to actually go after some of these root cause issues and see incremental changes in them that are going to take 10, 15, 20 years before we actually see them result in less opioid, less homelessness, better mental health.
Well said. You know, Pilar, I'm thinking about the economic development study that you did that shows that for every dollar invested in the library, $6 are returned to the local economy. And I'd love you to talk about how you did that work, and then also what intangibles were left off, because of course you do so much more than the 6x return.
Yeah, that's a really good question. So we hired a third party to conduct that research for us, again, to kind of emphasize the objectivity of the research. And they had done a similar study for Toronto Public Library, and it really is based on quantity. So it's the number of things borrowed, square footage, number of programs. So there is nothing qualitative in there at all. So that's just basic economics, I think, in terms of what dollars in and dollars out. We have done things like social return on investment reports with our social workers, impacting the savings. As Tina talked about, that proactive components, how they can contribute. There was a great project that was funded actually by the province of Alberta called the ECMAP, the Early Childhood Mapping Study, that studied communities across Alberta in terms of kids' readiness for kindergarten. So basically the impact of learning to read and loving to read. And interestingly, and Tina knows this really well, that it wasn't the communities who were economically disadvantaged who that were most impacted. It was also communities who were more wealthy, because two parents working, not taking the time to read to their child. So I think we also have to think about these issues, and literacy is a health issue, as affecting a range of populations. I think Francesco really articulated well how difficult it is to measure some of these things. I think we can use proxies. There's so much research on the impact of learning to read and being ready to read, whether it's succeeding in high school, you have a higher chance of getting a job, you have a higher chance of contributing to a civic society. Arizona predicts prison construction on literacy rates in the community. So that is a pretty good indicator of how much impact it has in folks' ability to contribute and feel successful.
Pilar talked about the ECMAP, so just back to that is absolutely research that is showing the impact of early learning and where Alberta's falling behind. So the first time they did that research, Alberta was below the national average for early learning scores at kindergarten. Edmonton was below Alberta. So they did that once. 4 years later, they did it again, and we were worse. And so what did they do? They canceled it. So the research is no longer available. So to the point of, you get what you measure, you get what you invest in, and the political cycle sometimes doesn't have the patience for that.
And the thing about this project, if I could just mention one more thing, it was very community-based. So there was involvement with schools, literacy organizations, the library, health. It was very collaborative, and there were communities of practice across the city, across the province. So it was very much grassroots. And then again, different provincial mandate, and as Tina mentioned, it was excellent research, though.
I'm curious, Brent, when it comes to Canada's mental health, how are we doing as Canadians? How does our treatment modality, the innovation in mental health in Canada stack up against international peer nations?
Well, I'm not an expert in in Canadians' mental health overall, but certainly I think that most of the research suggests right now that Canada is not on par with a lot of other countries, and part of that has to do with everything that we're talking about at the community mental health level. And I think that I don't have off the top of my head say what country would be a good benchmark. One of the things when you talk about treatment modalities, one of the challenges we have that is a bit related to what you're talking about in terms of data and whether it's clinical trial data or outcomes-based data related to mental health, challenging to get new medications that can help people into Canada. One of the challenges is the quality of the data and the fact. I shouldn't say the quality of the data. The way that data is evaluated in mental health relative to, say, hypertension or other treatments where there's more hard validated metrics, whereas in mental health they are validated scores. You would be very familiar with them, but when they're looked at by regulatory bodies and by provinces on do we pay for this or not, that is something that certainly comes into consideration. Yeah.
Do you have a role in lobbying for change as part of your mandate?
Within CMHA, we don't necessarily lobby on behalf of, say, from a medication point of view, but as far as mental health for all and mental health as a human right is a significant lobby effort from our national office and also provincially. I will say that within this provincial government is one of the few across the country that have a minister of mental health and addiction, and they have put a focus on that. They are a good partner, at least that we work with from a CMHA perspective, and also with AHS. But at the same time, I think there's more that needs to be done. And one of the challenges, I don't want to keep throwing up challenges, but one of the things that we're talking about is that there isn't necessarily, I'll use the term quarterback, there isn't a quarterback that's out there to lead some of the initiatives. There's as you say, some groups are trying to scope creep or go beyond what their abilities are, and I think that there are a number of I think collaboration, that's why I go back to, the innovation is collaboration, is how do we work as best as possible together? How do we, identify what the needs are in the community? And you've identified some that are certainly in the downtown Edmonton area. We've talked about a few more that are broader in the community. And I think, there are a number of people in the room here as well from corporate Edmonton as well that play a role in mental health in the community and so on.
Let's dig into that. I'm curious what role, let's say beyond HR or people in culture, that corporations are playing in mental health awareness or mental health eradication.
Well, what they're currently doing, I guess, when you think about corporate involvement in mental health, you think of Bell Let's Talk Day, and you think of some of the things that some of the companies have done. But I think that there certainly is an obvious role that, I used to work for Johnson & Johnson. I'm sure a lot of people with a small or big corporation, there's initiatives around mental health and growing EFAP supports and that sort of thing. I just think there's a bigger role to play in things that could impact things like early literacy, that could impact and supports for trauma, for other components that we're talking about here, that impact each one of their employees and their families, that maybe that opportunity could grow.
I mean, because should be something that Edmonton Unlimited can support, and I'd love to work with you on that. Tina, I understand that you and your team spend time reviewing proposals, and I'm imagining that there's a lot of ingenuity in those submissions. What are some of the innovations that you're seeing come across your desk that really impress you?
I mean, I think the charitable sector in general is pretty innovative because they're often thinking about scarcity. They're thinking about how do I do more with little for a growing need. But there was an interesting conversation that I wasn't there, but I heard some of the results afterwards. And it was basically 50 social sector organizations in a room talking about how do we do things differently. And Liz O'Neill, who's been in the sector for a long time, is the executive director of BCG Bigs, Boys and Girls Club in the city. And she said, you know, there's 50 of us here. We probably have over $100 million, more than that, in operational dollars. We can't pull together $50,000 to do a project. That's a problem. So money is not the problem. I think about the health care sector. Like, this is our largest funded sector. The money is not the problem. I think sometimes we're thinking about ourselves individually. So one of the things, for example, Reg and I had an original conversation about this, is data. All of these organizations capture data. All of these organizations need data. The data is not shared. What could we do if we shared some of this information and tried to tackle some of these problems together? Similarly, you know, I just am working on a strategic plan, and we want to do some research on gaps in the community where ECF can play a role. There are probably 8 organizations that invited me to research projects. This is another one. We're all researching the same things. We're asking the same questions of the same people. Is that the best way for us to use limited funding? Could we make better decisions if we did this research together, published the research, made it open and available so that people can make decisions on data that's available to them now versus having to do it themselves? So I think those are there are more and more opportunities like that where we can use scarce resources more collectively and, again, meet the needs that we all have in common.
Okay, very good. Okay, Francesca, this one's for you. I'm curious about the social determinants of health, specifically things like how do experiences in early life affect the outcomes that you're seeing? You touched a bit on gender. Let's talk about childhood and what we can do as a community to support healthy kids.
Yeah, sure. I can share from the context of my personal experience. I remember I was at a conference hosted by the Alberta Family Wellness Initiative about 10 years ago, and they had a speaker who came up from the Centers for Disease Control, Rob Anda, and he talked about the adverse childhood experiences study that they had done, where they were able to kind of link, and they couldn't necessarily find that it was a causative link, but they found a link between severity of developmental trauma, so different forms of trauma, and health outcomes in adulthood. So it's intuitive that if you traumatize or if you abuse a human being, especially during developmental years, people understand that they'll probably end up with some emotional health challenges, sometimes addiction issues in adulthood. But this study was really groundbreaking, excuse me, because it opened the door to understanding that there were other disease processes that were affected. So the initial study was around obesity, but then as more and more research is done, they're finding that developmental trauma is linked to heart disease, lung disease, certain forms of cancer, diabetes, certain forms of kidney disease, and the list goes on. And so from my perspective, hearing that was transformational, because I started to understand my own clients better and talking to them about the impact of developmental trauma, I think was very therapeutic for them, because it started to help them to understand that while society's set up that we're all accountable for our lives, they weren't necessarily responsible for all of the obstacles they were facing in their lives. And then what we tried to do is we tried to innovate around how do we help people, because one of the most important findings was that, the impact of trauma was on the architecture of the brain, the actual neuro biological, neurohormonal effects on the brain, and that would lead to challenges with what we call executive function, decision making, impulse control, things like that. And the earlier you intervene, the better. And if you want a great example of an organization that's doing that with a great philosophy of philanthropy, it's the Alberta Family Wellness Initiative. But we work with adults who've already sustained, truckloads of developmental trauma, and sometimes trying to understand how do we kind of foster brain plasticity to help people to heal. And one thing that we found, and I'll give you a concrete example, 7 or 8 years ago when fentanyl really started to rear its head, I got a call from a psychiatrist who was working in government, and he said, Francesco, he said, if we give you more money, can you hire more physicians to prescribe more methadone and things like that? And I said, I really accept that pharmacotherapy has a role in this, but what we really need is trauma counselors. And people, especially if you don't have third-party insurance, and especially if you don't have cash, can't afford psychotherapy. And so we are able to leverage that to actually get psychologists to work with us, where clients could have really an unlimited number of psychotherapy sessions to address some of the root causes of what we were seeing was linked to their patterns of substance use. I have found that transformational, really understanding the role of developmental trauma, and it's a lot to unpack, but if people are interested, the Alberta Family Wellness Initiative has a great free course, and Calgary Police Services was having all of its rookies take this course before they started working on the front lines. Certain schools make it a mandatory part of their courses, and so So that's one thing that we've tried to really embed, and ironically, or maybe not, so the medical community is one of the slowest to really accept and absorb and assimilate and apply some of this research.
Just thinking about having access to something that's unlimited. You mentioned unlimited therapy. It's very reassuring, because I think having that scarcity hang over your head, I only have 3 sessions or I only have 6 sessions, it causes, it's almost like a re-traumatization for people. And so what you're doing to just kind of unlock that access is really profound. Thank you for that. Pilar, I was thinking about your leadership in positioning Edmonton as a UNESCO City of Learners. So some of you in the audience may not know, but last year, Edmonton was named North America's first United Nations City of Learners. Let's talk a bit about what that means, particularly for well-being for Edmontonians.
That's such a good question, and this was an initiative that was led by former Mayor Don Iveson. At that time, he was a councillor, and there was a lot of collaboration, and they came up with a strategy, and they were looking for a home, and he was on our board, so he suggested Edmonton Public Library be the home of the City of Learners. So there is an early literacy component to it, there's a health component to that strategy, and we worked on it for a few years, and luckily we have, and that meant involvement of a number of organizations, post-secondaries, the corporate, other agencies were part of a steering committee, and the city decided to apply for this recognition, so now it's in good hands with the City of Edmonton Unlimited. And again, I think this is about that collaboration and highlighting what's happening in our community. I think sometimes it's just a lack of awareness. We don't know that Edmonton Unlimited is doing this, or the Edmonton Community Foundation is doing that, or Boyle or Radius is doing. So I think this is a way to amplify the great things around learning that are happening in our city in a collaborative way, and now we have that brand of UNESCO, which I think will help leverage it as well.
Thank you, Pilar. It's been a treat working with you on City of Learners. I would love now to open this up to questions from our audience. Let's make it a little more interactive. I'm sure that you have been sparked a lot of ideas here, and you'd like to follow up. So over to you. Yes, please, with the hat. Okay, I don't know if everyone heard that. A double-barreled question, inviting City Council to sit in the library and inviting Edmontonians who are struggling into City Hall.
That's a very good question. So I think City Council is well aware of the challenges that we face at the public library, and this is not unique to Edmonton. This is across North America. There's a recent research paper that's been released by the Canadian Urban Initiative. Canadian Urban Initiative. Is that what it's called? Yes, and the Canadian Urban Libraries Council. You can Google it. It's called Overdue, about libraries taking on things I think that are a little beyond our capacity, and also that we need support. So I do think council is aware of the things. I'm not sure maybe sometimes around the intensity. However, I do think quite frankly, we have excellent support from our municipality. We were in a time of fiscal restraint just this past December, got additional funding to open increased hours on Sundays. So we are very grateful for the support we receive. So,
thank you, Pilar. Yes, please.
I have a question for Brent, if you don't mind answering. And it's probably not new. So 1 in 5 children in Canada will experience mental health issues. 75% of those children will not receive any support. So that's a lot. My question is, how can your association, or has it in the past, provided that meaningful conduit between these government mandates, directives, and these community organizations and startups, innovative groups, on creating those linkages? That's one question. And second, how can you become that agent? And I'm thinking about, for example, a simple framework that innovative startups can use on social emotional competencies that children should develop. That's something that we as startup community can align ourselves to if we work in that space. Thank you.
Great question, and I'll think of maybe an initial comment at it. Is so one of the things that the Canadian Mental Health Association does right now. One of the programs we run is a peer-to-peer program through Recovery College, and if Gary from the Edmonton region was here, he could explain much more about it. But basically, there are different components within that where there is basically peer-to-peer learning on how to address whether it's PTSD, childhood trauma, a number of different courses within that. That's one part. The other part is, and kind of going back to staying in your lane a little bit. The one other group we partner with a fair bit is CASA, Child and Adolescent Services Association, or something like that. Anyways, we partner very closely with them, and so they work a lot with youth as well. I really like your thought, though, as far as how can the startup community, how can they look at finding out where the opportunities are and what that partnership can look like. And I'd love to continue that conversation for sure, but maybe I'll pass it along.
I'll add just a little bit to that, because there is some work that's happening right now. So back to my comment about the social services sector, the nonprofit charitable sector is thinking about these things already. So there is a group of mental health organizations working together with the city and the United Way to come up with a more macro strategy, so that it isn't all individual organizations doing it in piece parts and then other organizations recognizing that mental health is a huge issue and adding it into the services that they do, so that there can be a more united approach to mental health issues in Edmonton. So that's in progress right now.
Sorry if I could, you just made me think of something else, and this is maybe targeted a little bit more at like teenage youth, but I think it's quite broad, is the integrated youth hubs used to be something, but now Kickstand, through the funded by the Mental Health Foundation in Edmonton, is a group that I think collectively a lot of us and our associations have been involved with as well. But they certainly target that as well. But it's again a collective approach for youth to access help and services and so on.
Okay, over to you.
Thank you, and thank you to all the panelists. This is a question for any of you who have a good answer for it, and I'm curious if you have been excited by or inspired by any startup company in Canada that you think address some of the issues that have been discussed today.
Okay, well, this is an opportunity, right, for us to connect some of the startups that we serve, for example, through the Community Safety and Wellness Accelerator, and make sure that they are introduced to all of you, that they have the right connections at this ecosystem level. So thank you for your question.
It's not a startup, but I'm going to plug it because, again, it's Reg that's leading it. But it is this idea of, because it's thinking about the social determinants of health and the organizations that are capturing the data. So Health City is actually leading it to get, I think there's 10 health-serving organizations or serving vulnerable populations. So IFSA, Boyle Street, I think BCG Biggs, they're all participating to put their data into one source. I think there's definitely opportunities from a data perspective that are untapped, because this is like, we all recognize it in the tech sector, we recognize it in business. You can make better decisions when you have better data. I'd say the nonprofit and charitable sector, many of the sectors that are serving these, health crises don't have the data, don't have integrated data.
I can actually think of a few examples. I don't know what their business model is necessarily, but with the population I work, there's an organization called Missing Links. So when individuals need home care, sometimes home care has exclusionary criteria, and sometimes social kind of chaos in a living environment might be one of those. And so Missing Links will go and provide home care where there's a gap. So where home care won't go, Missing Links will go and provide similar services. So that's one. A local pharmacy actually created an outreach team. So for clients who are homeless or precariously housed and need to take daily witnessed medications like methadone or HIV medication or Hep C medication, there's a pharmacy team that will actually go to the clients and track them down and help them be compliant to medications, which has had a huge impact. Another one is, there's one called Speechified. It's a bit of a shameless plug because my wife's led it as a speech pathologist. She took brain science. And to the question about in children with mental health challenges, a lot of times we feel like we need to give the whole complete package of treatment, when a lot of times if you can train caregivers to give maybe the 3 foundational kind of forms of treatment, that will really help alleviate a lot of the challenges. So Speechified is an online kind of program that teaches trainers, caregivers to help with speech issues, which then are quite foundational in brain development, things like that. So that's another one. And the fourth one slipped my mind. But there are a few that are trying to be innovative in that space.
And this is related, and maybe Health Cities has an answer to this, but I'm curious because we've talked about nonprofit, we've talked about the public system, and I'm interested with all the new startups in the private sector having to do with healthcare, how are they communicating with each other? Because as we know, many times the left hand doesn't talk to the right. So I'm curious if you have examples of ways that they can start to communicate with each other.
So I know our health organization was asked to lead the Edmonton isolation facility during the pandemic. So individuals who were experiencing homelessness and became ill couldn't get into shelters because of the legal requirement to isolate. And so we had to create a space where people who were experiencing homelessness and were ill could go and isolate as per the legal requirement. And what we found is that there had been a lot of disconnection between social agencies. And so what it took, back to earlier points, is it took some leadership. And so AHS actually created a vulnerable populations task force. And then it invited all the community agencies who serve this population to come together. And for a while, when we were at the height of the pandemic, we had a daily virtual meeting where it was just a check-in to see where are the numbers at, where do we need to have response. And so one thing we learned, one of the silver linings of COVID in Edmonton was that if we build that connectivity, and it can be as simple as just having one stakeholder, usually if it's health-related AHS, they just created a round table where agencies were invited to sign on to and report and connect, and we're able to find that we're able to do a lot of innovative things without it being, without it costing a lot more than we already had in our budgets. And so that was one example, and it was very simple, but it was driven by a fairly exigent need, right? So I'm not wishing for anything like that to happen again, but it did teach us something.
Fabulous. Okay, we are just about at time, and before we wrap, I just want to ask our panelists, rapid fire, what is the single most significant, innovative thing that you each plan to do in 2024?
Well, I'll start, and they're not, like, this is where it's not tech and it's low. Like, so one is focus. So we are a 360 funder. We fund everything. You noted we are the largest funder in the city. We can be patient. So I want to focus our funding on gaps that we see in the community. And so that's where the research came in. I don't want to spend time or waste time and resources on research that's already been done. I want to use the research that's available. So some of these things are, for me, learning about the efficiencies we can gain by doing things a little bit differently. So the one is focus, and then the other for me is these things like data and research. Why are we asking charities to be experts, nonprofits to be experts, small organizations experts in things that they have no expertise in? Like, can we do this together? Can we do it for them and get better results?
Amazing. So focus, patience, and recycling of data. I love it. Pilar.
That's 3 things, just saying. I'm going to say celebrating convivencia, which is a Spanish word or a Portuguese word which translates literally into conviviality, which means merriment and fun. And that is not actually what the concept means, though. It means how do we work together and kind of rub along together when we're in public spaces where there's natural tension and discomfort. So that's what we're going to do at EPL.
So living with merriment and discomfort.
Not really, but convivencia, which means being together when it takes practice, when there are conflicting interests and tension in a space. So I think that's the public library, and there's so many beautiful things that happen, and we want to celebrate that.
Thank you, Pilar.
I have a more practical application, but I love both of the examples. So we're trying to forge ahead into the world of corrections. There's a real disconnect between individuals who are beleaguered and disenfranchised in society, between health and the correctional world. And so Mental Health Korte, which was founded several years ago by Justices Rene Cochard and Larry Anderson, has created a space where individuals who have mental illness can come and be heard in a judicial setting with consideration to the mental health challenges they face. But the missing piece often is health. So Radius is trying to bridge that gap and trying to collaborate with Mental Health Korte. And I remember we've done kind of some pilots, but once the judge called me and said, we've got a guy here who needs a treatment medical done, and the judicial order got lost in the remand center. And so I just went to the courthouse, to the antechamber of the courtroom, and just did the treatment medical there, so that instead of going back to jail, the individual could go to a treatment facility, right? So not a typical day, but it creates an awareness of some ways that we can do things differently that will hopefully make an impact.
A very bold house call on your part. Much appreciated. And Brent, take us home.
That was a good one, the house call part. I think it may not be as innovative, but I think what we're talking about, the intersections and the connectivity, I think is a huge part of community mental health and a huge part of where CMHA is going in Alberta. And that's certainly something that I hear from the panel here, and even from the questions that we heard. So that's where we're going forward.
All right, well, what a fantastic panel. I want to thank our audience. I want to thank Health Cities. Reg, come on back up, and let's give everyone a big hand.
Thank you, everyone. It's a wonderful panel. Thank you for your insights. I think there's a lot of opportunities where our city can take the lead on some of these interesting challenges. And we think we have a lot of passion and strong leadership in our organizations here to make that happen. So thank you all again. For lunch, lunch is going to be served right over there, courtesy of Alberta Council. Andre Despens is here from Alberta Council. Go over and say hi to him if you have a moment, and enjoy lunch, and we'll meet back here right after lunch. Thanks, everyone.